small presentation, let us see how to measure cervical length transvaginally. Cervical length is the only direct way of assessing the patient's risk for a spontaneous preterm birth, while the rest of other things like history and other factors are surrogate markers. But before we learn how to measure cervical length, let us look at some of the basics. We are using a transvaginal probe, and the probe is now covered with a sterile sheath over here. Always examine the patients with empty bladder, because if the bladder is full, it will lead to opposition of the anterior and posterior uterine walls, making the cervix longer. So erroneously, you will end up in measuring a longer cervical length. So always examine the patients in empty bladder. Take the patients to the edge of the table, and if the table has got a lithotomy curve like this, it will be very easy. If it is not there, then you can design a pillow like this, which can be kept under the patient's buttocks so that the probe can be maneuvered, the probe can be moved quite comfortably. Now let us look at the image. In this image, now you will see this is the internal os and this is the external os, and now we will measure the cervix. So beginning from the internal os at this point, and you come over here, and this is the second point, and then we can see the cervical length is 3.4 centimeters or 34 millimeters. So try to identify the anatomical endpoints, the external cervix, external os, and the internal os. The internal os is not here, but you can see the internal cervical canal over here. So we begin from this point and come at this point. Again, some precautions to be taken. Keep the probe always at the level of the external os and never push the probe into the posterior fornix. Please notice what is happening here. When the probe is being pushed into the posterior fornix, the cervix is getting elongated because the fornix is getting stretched, the cervix is getting elongated, and again you will end up in measuring the cervix on a higher side. So the probe has to be always kept at the level of the external os so that you get the entire image, identify the internal os and external os, and measure the cervical length. Remember, always measure cervical length in all women irrespective of their prior history. It is an universal test. Always measure cervix by transvaginal route. First measurement is done ideally between 11 to 13 weeks and second measurement at 18 to 22 weeks. Look at the difference between these two measurements. If the decrease is more than 10 millimeters, the risk of spontaneous preterm birth will be higher irrespective of the initial cervical length, which will be sometimes more than even 2.5 centimeters. Offer individualized care for these women. Let us see one example. This woman presented at 22 weeks with increased discharge, and look at the cervical funneling with echogenic debris over the internal os. The cervix is measuring 2.4 centimeters. This is the cervical length. Look at her first trimester cervical length measurement, which was 3.4 centimeters. So there is a decrease of 10 millimeters between the two measurements, and this patient requires further treatment.